The topic of today's lecture is anthelmintic drugs, and anthelmintic drugs are directed towards the diseases caused by trematodes, nematodes, and cystodes. So these are three major groups of helminths or worms, and the choice of drug depends on the type of the worm that will cause the disease. And the uh, nematodes diseases are cured by the diethylcarbamazine and ivermectin, mebendazole, thiabendazole, and pyrantel pomade. The trematodes are treated with the praziquantel, so the trematodes infections, and the cystode infections are treated with the albendazole and niclosamide. So all these infections are very common, and the incidence is varies depending on the type of the worm. Like nematodes are most common, and uh, the ascarids are like the most common of them, but also hookworms and filaria are common in Africa, and Anterobius and Schisto are common in Africa too. So, and ascaridiosis is common worldwide. Then the nematodes are roundworms that are elongated, and they have a digestive system, and they usually infect the intestine and also can go to the blood and different tissues. The main diseases are listed on this slide. The onchocerciasis or river blindness is common in Africa, but also in Mexico and South America. So, and Africa is actually mostly in the Victoria River, sorry, Victoria Lake, and the disease is characterized by the subcutaneous nodules and pleuristic skin rash, and ocular lesions will lead to the blindness. Treatment is with ivermectin is the drug of choice. Enterobiasis are the most common disease, and the pathogen is Enterobius vermicularis, and it is very common, and usually the white worms are visible in stools or in perianal region, and the S is usually ichty. So the treatment is with mebendazole or pyrantel pomade. Mebendazole is usually drug of choice. Ascariasis is the most common, also second common after the enterobiasis, and the disease is caused by Ascaris lumbricoides, and this is uh, ingested uh, by food or, or on the dirty hand, and then growth in the intestine that leads to the abdominal symptoms, and then roundworms might pass to blood and then eventually to the lungs. The treatment is the same as the antirhybiosis, mebendazole, and parenteral pomade. The filaria uh, is a worm that lives in the lymph and then leads to the fibrosis and inflammation of the lymphs, and uh, that lead to elephantiasis. So elephantiasis usually the legs become very uh, very wide. So the disease is treated with a combination of diethyl carbamazepine and albendazole. Then trichariasis is a whipworm and is usually asymptomatic, and treatment is mebendazole. Mebendazole is most frequently used agent, and hookworm is uh, is a worm that attaches the intestinal mucosa and lead to the anorexia, ulcer-like symptoms, and chronic intestinal blood loss. Then eventually will make an anemia, and uh, uh, this treatment is the same as the uh, previous as a enterobiosis and as as enterobiosis, ascariasis, and filariasis, so mebendazole plus parenteral pomade. Parenteral pomade. So so kids are going crazy upstairs. So then strong threadworm disease uh, that is not very common and usually benign, but in HIV patients can lead to the death, and treatment is ivermectin, and trichinosis is actually uh, Trichinella spiralis, and usually caused by consumption of inefficiently cooked meat, same as uh, the uh, Georgia diseases, and that is albendazole and mebendazole. Uh, the uh, trematodes uh, uh, trematodes are leaf-shaped flatworms, and uh, usually uh, they have a trophy to the specific tissue, like the uh, par paragonimiasis is the lung fluke, and they move from the GI to the lung, and uh, then usually it's transmitted by the raw crab meat, and usually eggs are seen in the sputum and the feces. The treatment is praziquantel. So all these are due to the praziquantel, that is an agent of choice for the all forms of the schisto and other trematode infections, and also cystode infections. Praziquantel is also used for the treatment of cysticercosis that is caused by the Denisolium larva, but it is off-label. The mechanism of action is based on the calcium permeability increase that will lead to the contraction and paralysis of the trematodes. Praziquantel should be taken with the food and not chewed due to bitter taste, and its oral absorption is very good, and it distributes to the central nervous system well. The common adverse effects include dizziness and headache, as well as the GI disturbances, and it's contraindicated uh, for the treatment of ocular cysticercosis because destruction of the organism in the eye may cause irreversible damage to the eye and blindness. And the cystos are true tapeworms, and they have flat segmented body and attached to the host's intestine. Like trematodes, the tapeworms lack a mouth and digestive tract, and the niclosamide is an alternative to the praziquantel for the treatment of the teniasis and other cystoid infections. It inhibits mitochondrial phosphorylation of ADP, that is adenosine diphosphate, and uh, making the killing the cystose scolex and segments, and but the ova will survive. So laxative is administered prior to the oral administration to purge the bowel of dead segments and to enhance the digestion of liberation of the ova, and also contraindicated with an alcohol. Due to the pharmacokinetics, the alcohol should not be taken 1 day before and after, because niclosamide will remain in the body for about 12 hours. Albendazole is another benzimidazole that inhibits the microtubule synthesis, and no, they're crying. Okay, it's effective against most nematodes now, and the primary therapeutic application is cystodal infections like hydatid disease and cysticercosis. So cysticercosis produces cysticericin in the brain, and that leads to the seizures, headache, and vomiting, and also can produce them in the eyes. So this disease is ingested of eggs from the human feces and is diagnosed by the biopsy or computed tomography scan. Azicmantel and albendazole with surgery are indicated for the treatment. So, albendazole is excreted in the bile, and the best effects are mild and usually only headache and nausea. When used for the long time treatment, like during the hepatic disease, this has a risk of hepatotoxicity and granulocytosis and pancytopenia. Uh, so the treatment is usually associated with the inflammation because of the dying results in the central nervous system, and that leads to the headache, vomiting, fever, and seizures. So hepatotoxicity is rare but can be risky. So these are all the helminthic diseases. Uh, any questions? So if there are no questions, then thank you for attending and see you next week. Have a good holidays. Bye bye.